In any real incident, it is also likely that a great many people will rush to the scene. The diving team must hold them in check, and they must carry out calmly and effectively the emergency procedures they've been trained in. Once on deck, resuscitation should start as soon as possible. Every minute counts. An unconscious diver who is not breathing may be suffering from lack of oxygen, either through partial drowning or asphyxia, or from gas embolism or decompression sickness.
No, he's not breathing, but I've got a pulse.
The diving team should not attempt to diagnose the problem, but to recompress both diver and standby. The casualty must be accompanied into recompression by a properly trained paramedic if possible. In this case, it is the standby diver. Whether offshore or inshore, if there's going to be any delay before recompression, resuscitation must be carried out during this period. This treatment of recompression and resuscitation will be of benefit whatever the cause of the problem. The supervisor will decide whether any further personnel are required in the chamber to help the diver and the paramedic.
Let me know when I can take the shots away.
The first step in any resuscitation is to get a good neck and jaw extension. Then, if necessary, the airways must be cleared of vomit. The upper bronchial tract may contain water, and if so, it must be emptied out.
Take you down 18 meters. Roger, surface.
Speed of action is essential. Brain damage will begin a few minutes after breathing stops, and it's irreversible. Once the lungs are clear, mouth-to-mouth or mouth-to-nose resuscitation can begin. A plastic airway can also be used. The tender blows deeply and slowly into the casualty's lungs, making sure he has an airtight seal. He blows until he sees the chest moving. This technique is called exhaled air resuscitation, or EAR for short. If, after a few long inflations, the casualty is not breathing and he has no pulse, cardiac massage can be incorporated into the resuscitation program. The pulse is most easily felt at the carotid artery at the base of the neck.
Got a pulse, surface. He's still not conscious. Yeah, understood.
The casualty's clothing should be loosened to aid his circulation and breathing. The objectives of resuscitation are to get the patient breathing and to get his blood circulating. After delivering a good inflation, the tender removes his mouth and allows the air to escape from the casualty's mouth. He must watch the chest falling and avoid exhaled air. 10 to 12 breaths per minute is the correct rate for EAR. It should be continued for an hour or more, particularly if the casualty has become so cold that body temperature has fallen.
You hear me, Tony?
Further personnel may be needed to be locked in with the casualty to make this possible. People have survived conditions that would, under normal circumstances, be considered impossible.
His colour's coming back and seems to be coming round a wee bit.
The human system is extremely resilient. Don't give up hope.
You're safe enough.
Only a doctor is qualified to stop resuscitation in less than 1 hour.
His eyes are open.
Once the casualty is breathing, attention can be turned to his other injuries. Bleeding is one of the few other conditions that can be treated in a compression chamber. This should be stopped by applying pressure by hand or with a
Put
bandage.
him on the ambu bag. Put him on now. Yeah, he's looking much better.
Yeah, okay, Mac. You think he's well enough to go on bibs by himself now?
Just keep your eye on him, will you?
Come on, bibs, Roger.
Throughout the emergency, take as many notes as the situation permits. These will provide invaluable information for expert medical advice.
Surface divers on bibs, breathing independently.
The supervisor should avail himself of his company's doctor at any time he thinks necessary. But it is imperative that the doctor's advice is sought after anyone has been unconscious, whether they appear to have fully recovered or not.
Okay, Sonny.
Yeah. No.
All right,
Good.
mate. Okay.
Good. Good, fine now.
Any diver who has had breathing difficulties or who inhaled water should be carefully watched for at least 24 hours to guard against the danger of secondary drowning. This is a delayed reaction which occurs when body fluid fills the lungs and breathing becomes rapid and more difficult.
How are you feeling anyway, okay?
Yeah, I'm feeling a lot better now, mate. Really.
You should be okay. Right? 3 and 1. You can blow 'em up. 1, 2, 3, 1.
There are few industries in the world where man operates in such a hostile environment as the diver carrying out his work below the surface. His life depends upon his diving team. Every member of that team has a responsibility for the safety of every other member. The roles of the tender and standby diver are both crucial to any safe surface-orientated dive, whether offshore or inshore. Today, much air diving is done using a wet bell. The second diver performs the tasks of the tender and standby diver. His role is similar to that of the bellman in bell diving, except that he sometimes accompanies the diver to the worksite. In the second part of this film series, we will look at the role and duties of the bellman. In all diving, good training and adherence to proper working practices are essential. There are no shortcuts in diving safety. Diving is only safe when you remember that it can be dangerous.